consultation between a psychologist and a patient called Mr. Barry. For questions 1 to 12, complete the notes with a word or short phrase.
Hi there, Mr. Barry. Your GP has referred you to me to discuss your anxiety. So tell me, how have you been feeling?
Well, I'm still suffering from the anxiety and panic attacks, and the medication that I'm taking, I found that it seems to have some side effects and it makes me still feel a little on edge. So I found it better to take the medication at night rather than in the morning, and so I can get...
Consultation between a psychologist and a patient called Mr. Barry. For questions 1 to 12, complete the notes with a word or short phrase.
Hi there, Mr. Barry. Your GP has referred you to me to discuss your anxiety. So tell me, how have you been feeling?
Well, I'm still suffering from the anxiety and panic attacks, and the medication that I'm taking, I found that it seems to have some side effects and it makes me still feel a little on edge. So I found it better to take the medication at night rather than in the morning, and so I can get on with the day kind of thing, but I still feel quite anxious.
Okay. Getting used to the medications can be difficult. Going back, when did you start the treatment again?
3 weeks ago now? And that was the citalopram, the one to hopefully control the panic symptoms longer term, and the chlordiazepoxide, which is for the more short-term control.
How many of the chlordiazepoxide are you using a day at the moment?
Well, the doctor gave me 20 milligrams 3 times a day, but to be honest, I'm trying to cut them out. I only use them if I really, really need them.
Good. And do you feel okay with that?
Yeah, it's like I don't feel like they suppress me enough, if you get what I mean. I know that my main aim to tackle this is, to be honest, is getting fit and more exercise, because I know that's the feeling that I need to aim towards. Because I know from past experience that when I work out, I feel...
হ্যালো আজাদ ভাইয়া, শোনা যাচ্ছে? লিসেন। জি, হ্যাঁ হ্যাঁ, দেখতে পাচ্ছি। এটা কোনটা ভাইয়া? E2 নাম্বার কি হচ্ছে? হুম, জি।
A consultation between a psychologist and a patient called Mr. Barry. For questions 1 to 12, complete the notes with a word or short phrase.
Hi there, Mr. Barry. Your GP has referred you to me to discuss your anxiety. So tell me, how have you been feeling?
Well, I'm still suffering from the anxiety and panic attacks, and the medication that I'm taking, I found that it seems to have some side effects and it makes me still feel a little on edge. So I found it better to take the medication at night rather than in the morning, and so I can get on with the day kind of thing, but I still feel quite anxious.
Okay. Getting used to the medications can be difficult. Going back, when did you start the treatment again?
Oh, what, 3 weeks ago now? And that was the citalopram, the one to hopefully control the panic symptoms longer term, and the chlordiazepoxide, which is for the more short-term control.
How many of the chlordiazepoxide are you using a day at the moment?
Well, the doctor gave me 20 milligrams 3 times a day, but to be honest, I'm trying to cut them out. I only use them if I really, really need them.
Good. And do you feel okay with that?
Yeah, it's like I don't feel like they suppress me enough, if you get what I mean. I know that my main aim to tackle this is, to be honest, is getting fit and more exercise, because I know that's the feeling that I need to aim towards. Because I know from past experience that when I work out, I feel better, I feel more relaxed, etc. So I'm trying to work towards that.
So, how many actually are you having at the moment?
Today I've had to go into work just for a conference with my manager, just to discuss how things are going and stuff. So I had to take 2 because I just felt like I couldn't manage it otherwise.
Right, okay. So, over the past 4 or 5 days.
None except for the 2 today.
So, you've actually been laying off them altogether.
Yeah, I've been trying, and when I do take them, I only feel suppressed for a very short amount of time.
Right. Now, the citalopram medication.
Yes, I'm on 20 milligrams once a day, and the side effects, headaches, were quite bad to begin with, and I'm still getting them, but I think that could be more stress related, because they're not very... I found that if I take it first thing when I get up, I still feel quite edgy, and also the side effects.
Yes, okay, right. Now, the reason you started the treatment was because you were getting full-blown panic attacks. Can you tell me a bit more about the attacks?
Yeah, well, I couldn't leave the house, my heart races, and I really struggle to breathe, and I just feel an intense fear. It makes me feel sick and dizzy if I go out into the street.
You find it very difficult to get out and about. Are you beginning to normalize, do you think?
Yes, I've managed. I went over to the soup store on my own and I managed. I felt a bit jittery at first, but I've learned over the years, after suffering quite severely with them years ago, that you just have to take your mind to a different place, and I just concentrated on what I wanted from the shop. That was the first time I've been out on my own since I started on the medication.
You will hear part of a consultation between a GP and a patient called Mr. Martin. For questions 1 to 12, complete the notes with a word or short phrase.
Hello, Mr. Martin. I'm Dr. Hampton.
Hello, nice to meet you.
And you? How can I help you?
Well, I've come about my stomach. I've had problems with it over the years, on and off, but at the moment it seems to be worse again. Mainly kind of just real sore feelings across here.
Okay. When you get the pain, where is it exactly? Can you show me?
Yes, it's here. It's sort of across the upper part of the tummy and down here to the middle of the tummy.
Uh-huh. And how would you describe the pain? Could you put words to it?
It's more sore. I can't say it's a real pain. It's more a sore feeling and like irritation, maybe?
Right. Does it move around or is it always in the same place?
Yeah, I mean, sometimes it always seems to start here in the middle, kind of. I can feel a bit there now, but I've had it more down each side as well, and I didn't know. At one point I wondered whether it was my kidneys or something, or whether it's still the same thing. I don't know.
Okay. And you said it's both sides. Do you mean together or does it sort of flip from one side to the other?
Yeah, not together. Mainly kind of just real sore feelings across here.
Okay. When you get the pain, where is it exactly? Can you show me?
Yes, it's here. It's sort of across the upper part of the tummy and down here to the middle of the tummy.
Uh-huh. And how would you describe the pain? Could you put words to it?
It's more sore. I can't say it's a real pain. It's more a sore feeling and like irritation, maybe?
Right. Does it move around or is it always in the same place?
Yeah, I mean, sometimes it always seems to start here in the middle, kind of. I can feel a bit there now, but I've had it more down each side as well, and I didn't know. At one point I wondered whether it was my kidneys or something, or whether it's still the same thing. I don't know.
Okay. And you said it's both sides. Do you mean together or does it sort of flip from one side to the other?
Yeah, not together. It goes from one side to the other.
So it really moves around this pain, doesn't it? Do you get bloated when you get the pain?
Yes, very bloated.
And can you tell me how long this has been happening?
Well, I first had it several years ago. I had it when I was working, and a doctor I went to see said then it was probably irritable bowel. That was 4 years ago.
Right. Was the bloating a part of that too?
Yes.
And did things settle down for a period of time?
Yeah, they settled down when I was watching my diet much more, and when obviously I wasn't as stressed. I'd given up work.
Okay. What about your bowels? Can they be a bit variable?
Yes, very much so.
Could you tell me a bit more about that?
Well, I've always had a bit of a problem with constipation, mainly. But I mean, I'm going just recently going perhaps a couple of days and not really going. And then like in the last couple of days, every time I eat, I seem to want to go.
Right. And are you getting loose motions?
It's loose, yes.
Right, okay.
Yeah, I mean, really, nothing has changed. I mean, I drink loads of water, but when I'm constipated, it's really hard and just like, you know, like small brown pieces when I go. And then when it's loose, it's a bit ribbony. I've always had a bit of a ribbony movement.
Yes. Is it true diarrhea or not?
No.
No. Okay. Have you passed anything unusual looking? Any blood or slime or anything strange?
No, I haven't.
Haven't passed black motions as far as you know?
No.
When you had the IBS before, what sort of things did you do for it?
I think Dr. Dorsey gave me some Colofac, is it? Or something like that?
Yes, that sounds right. Was that helpful?
Kind of. Because she explained to me about a kind of a spasm thing. But I just kind of watched what I ate again. I mean, you know, it's probably worse if I don't go to the toilet. And so, you know, I try to eat things and, you know, to make sure I do go without taking anything, you know, without any laxatives of any description. And then I know it's probably really old-fashioned, but I take peppermint oil. You know, the capsules? And I think they're actually really helpful.
Okay. Weeks 20. Suppress. Mm. 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 Mhm. হুম, আপার পার্ট আমিও ডাউন লিখছি, এখান থেকে তো মিডিল দিছে। ওমা এখানে হ্যাঁ ব্লোটেড এর 7 নাম্বার মিশাই দিছে, ইয়ে করে ফেলছে। ইরিটেবল বাউল। লুজ। আমি শুধু ব্লাড দিছি। ওকে, আমি শুধু ব্লাড লিখছিলাম। আচ্ছা, লেক্সেটিভ। তারপর মিন্ট অয়েল। হুম, আর আমার ওই দিক দিয়ে আমি ব্লাড শুধু লিখছি, ব্লাড ওর স্লাইম দিইনি।
You will hear part of a consultation between a GP and a patient called Mrs. Brownstone. For questions 1 to 12, complete the notes with a word or short phrase. Hi, Mrs. Brownstone. How can I help you today?
Hi there, Dr. Rivers. I'd just like you to do a test on my waters. I've had a few problems recently. I have to go quite a lot more, and it's started to burn a little and just been a little bit uncomfortable.
I see. How long have you had these symptoms for?
Well, it's been sort of goes on and off for about 3 weeks, closer to a month really. Some days it's better than others. I don't take too much notice. I put a lot of it down to age, but I don't think there's anything really serious, but just wondered. It seems a bit strong at the moment.
And have you had this sort of problem before a lot or not?
Oh yes, it's happened quite often over the time. Normally just antibiotics clear it up. I'd say I've been treated for this, at least 5 times in the last 10 years.
And you've left it for a few weeks before coming in to see me. Do you sometimes get symptoms that come and go like this?
Yes, they do. And I just try to drink more, which I'm very bad at, drinking water and such like, but I try. And it usually goes. Well, it usually just goes off by itself, really.
Okay, and what about nighttime? How are you at night?
Oh, I'm up and down a lot. 3 times out in the night at least, every night. And it's more painful at nighttime, funnily enough. And it's much more urgent. At night there seems to be a lot of pressure. I think it's been going on for such a long time it's becoming normal.
Right, okay, well, that's not something we want you to be getting used to. Let's see what we can do. When you've had these symptoms in the past, you've had the antibiotics, did it calm it down?
Yes, antibiotics seem to do the trick.
And what about accidents? Any accidents with the waterworks?
No, I just have to make sure I get there quickly. I do find when I've been sitting for a while, once I get up, I've got to go immediately. So I always want to know where the loo is wherever I am.
But if you cough, sneeze, or laugh?
No, nothing like that.
Yeah. So what I'm keen to do actually is just to give you a short course of antibiotics and see how you get on. If you've had this similar things in the past and antibiotics have helped, I think that the first step is to see what happens if we do the same thing.
Right. I'm not sure if this is important or not, but I had a series of water problems way back, 25 years ago or so. I had a colposuspension in 1980 something. I was 50. And that worked. It worked well, I think.
Good. Okay, let's keep that in mind, but we will start with some treatment. But if it's not improving, we'll need to reassess the bladder function a bit more closely.
Right, okay.
Are you allergic to any medications as far as you know?
Yes, there's a few. Septrin, amoxil, and... Oh, what's the other one? If you can just hold 2 seconds, I'll tell you. Keep it written down so that I can... So, Septrin, amoxil, and trimethoprim.
Trimethoprim. Glad I knew that, because that would have been my first choice. You've had something called nitrofurantoin?
Yes, I've been okay with that one. The nitrofurantoin, I've had it before for 5 days.
Right, thank you. So, as you asked for, I will get you to provide us with a sample we can send to the lab. I think that what I want you to do is drop back in and see us in 5 days, and we can review the results and discuss how the medicine is working, okay? You will hear part of a consultation between a doctor and a patient called Mrs. Chambers. For questions 1 to 12, complete the notes with a word or short phrase.
Hello, Mrs. Chambers. I'm Dr. Adhikary, one of the obstetricians working here at the hospital. I've just come to ask you a few questions. What is the reason you came into hospital today?
Oh, well, I started bleeding.
Oh, I see. When did you start bleeding?
I had a bleed on last Sunday.
Okay, and how many weeks pregnant are you at the moment?
I'm 36 today, and I started bleeding about a week ago.
And did you have any bleeding before that?
Actually, yeah, I did, in February.
Okay, in February. How much bleeding did you have? Was it quite a bit or just spotting?
About half a cup full, and I was 28 weeks then. But the bleeding only lasted for not long, a couple of hours, then it stopped.
Okay. And when it started last Sunday, how long did it last then?
It lasted for about 3 hours, but then I'm spotting and having some old blood coming out now. Yeah, and it was quite a bit of blood. I would say about a cup full.
A cup. Okay. And with this episode, did you have any pain anywhere at all?
I just get a tightness in my tummy and I get cramps. And a quite severe pain in the lower abdomen here for a bit, but it comes and goes. It started when the bleeding, at the same time as I was bleeding.
Okay. And did you have pain at 28 weeks when you had the bleeding then as well?
Yeah, it's just like period pains, cramping.
Okay. All right. Any other symptoms at all?
No, not really.
Okay. And with this pregnancy, other than the bleeding, have you had any other problems?
No.
Okay. And have you had a scan since this bleeding started?
Yes, I had one when I was 34 weeks, and they found the placenta was low, but I haven't had another one since.
Okay, and when is your next scan due?
I haven't got another one now.
Okay. All right. And when you had your booking scan at 12 weeks, everything was normal then?
Well, in my first scan, they struggled at 12 weeks to find it, so that was sort of like an internal scan, but they just said it was because it was a small baby or something. But other than that, everything was normal, I think. My visit at the antenatal clinic, everything was normal. I remember my Downs risk was low.
Okay, so everything was fine. That's good to hear. All right. Have you had any previous pregnancies?
Yeah, I've got 2 little boys. They're 2 now. Both very healthy, just a bit naughty.
All right. They twins?
Oh yes, sorry, they're twins.
And was it a normal delivery or was it by cesarean section?
No, normal.
Normal delivery, no instruments used, nothing like that? And you didn't have to go into the intensive care unit or neonatal unit, nothing like that?
No.
Okay, all right. I think I'm starting to get a good picture. Tell me, have you ever had any uterine surgery or procedures?
Oh, yes, about 4 years ago, I had to have an abdominal myomectomy.
Oh, I see. That's good to know. What symptoms did you have with that?
It was almost exactly 2 years before my boys were born. I was really suffering, migraines, body aches, and even a fever with my period. One time the pain got so bad I had to go in for an MRI, and they found some pretty big fibroids, and at the time we were struggling to get pregnant, so the doctor suggested I have the fibroids removed. I was really nervous and considered not getting it done, but it seemed to work really well. And 2 years later, we had our boys. I never really felt any ill effects from the procedure, apart from just taking time to heal.
Mm. Mm. 3 weeks. Let me see. আমি শুধু 3 লিখছি এটাতে, কারণ পিছনে তো উইকস লেখাই আছে। Mm. 1 week. Quad abdomen. 7 small. আমার 8 গেছে, আমি ডাউন রিক্সটা বুঝি না, এটা মিস গেছে আমার। ডাউন রিক্স, ডাউনস রিস্ক। হ্যাঁ, আইআরএস করবেন না? আচ্ছা ভাই, আপনি আমার পারলে এগুলো একটু দেন না, আমি খুঁজে পাচ্ছি না। এটা আমারে তো স্বপনদা দিছিলেন, কিন্তু মানে আছে কয়েকটা, বাট আপনার এগুলা নাই। যদি পারেন আমার একটু প্লিজ দেন না, ইয়ে করে ফাইলটা। তাইলে আমি এই দুইটা রাত্রে বসে শেষ করে কালকে সকালে ইয়ে করে ফেলতাম আর কি, বা কালকেই শেষ করতাম। আসছে আসছে, থ্যাংক ইউ ভাইয়া। হুম 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 ওকে, যেটা হচ্ছে গিয়ে পেশেন্ট নেম ডলার্স হাফম্যান MS, patient history, date of birth 22 June 1986, allergy to penicillin. Social history, single woman, no family in Australia, lives with long-term boyfriend, sales assistant, lady sawyer in a department store. 11 December 2013 at pub last night with friend, 2 glasses wine plus several cocktails. Then fainted 5 to 10 minutes unconscious, vomited once, no history of fits, seizure, incontinence. No symptoms, gastroenteritis or UTI. Works very busy or stressful. Feels wheezy today, no appetite. Requested checkup. On examination, slightly pale, temperature 36 degree, pulse 72, regular, BP 120/70, medical certificate, 1 day rest, watch for 2 new symptoms, blood test normal. Then 7 August 2014, skin check, several moles, left and right neck. Okay, advice to monitor for changes. 2nd September 2014, URTI since 2/52. Your বুঝি নেব এটা কি? Okay, 2 weeks. Okay. 6 weeks. Okay, yellow green sputum, SOB, এটা কি জানি, shortness of breath है. তারপরে tight chest, wheezy, lethargic, smoker. Anxious, refer to এটা কি EBV, EB, Epstein-Barr virus. Work colleague is off with it. Reassurance. RC test mode given 2 days. Rest medicine maybe. নিচের দিক দেখা যাচ্ছে না ভাইয়া। Okay. Certificate, medical certificate given for 2 days. Ordered bloods. Then 7 September আরেকটা visit, যেটা হচ্ছে কি সব blood test করাইছে। November 22, 2014, orofacial HSV 1 for 3 days. Treatment cyclovir 200 milligram 4 hourly for 5 days and topical cyclovir to 3% QID 3 times. Okay, job stress 3+, causing depression, nightmares, insomnia, difficulty getting up, loss of appetite, low libido, poor memory and concentration, loss of pleasure, loss of confidence, low tolerance of alcohol. Split up with boyfriend, no now live alone, considering quitting job, want a break from working. Okay. Recommended referral to psychiatrist, patient resistant. Okay. Treatment Tremazepam 20 milligram 30 minutes before bed. RV 1 week. Okay, then হচ্ছে গিয়ে 29 November 2014 diagnosis reactive depression and anxiety. Patient has not filled tramazepam spirit, not keen on drug treatment. Patient has agreed to referral to psychiatrist. তারপরে নিচে line. Using this information in the case note, write a letter to referral to Dr. John McLean, psychiatrist, Royal Mental Health Clinic, 177 Park Avenue, Newtown. বুঝছি। Now এখন লিখতে হবে 180 ওয়ার্ডে। না, এটা তো রেফারেল লেটার, আর্জেন্ট না। Doctor name. Hmm. Hmm. সাইকিয়াট্রিস্টের কাছে রেফার করে দিছি। হুম 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 And management would be highly appreciated. এটা সব গুলাতে থাকবে। হুম। 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 হুম 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 বয়ফ্রেন্ড ছিল, বয়ফ্রেন্ডের সাথে স্প্লিট আপ হয়েছে। With her boyfriend. It should be mentioned that she is allergic to penicillin. হুম হুম You please do not hesitate to contact me. Yours sincerely, doctor. তখন গ্যাপ থাকবে না, আজকের তারিখ আর ডিয়ার ডক্টরের মাঝখানে তো এক লাইন গ্যাপ থাকবে। বুঝছি বুঝছি। হুম 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 ওকে